Good afternoon, everyone. Thank you, Thibault, for that introduction. And thank you to everyone who's here as well. Speaking immediately after the lunch session is considered the graveyard shift. So it's particularly challenging, and you've just shown us now how challenging it could be. But I hope your tummies are satiated, and the postprandial blood flows, I know, is now focused on digestion. But I hope to make this as interesting as possible, and I've opted to go for brevity. So I have a very short presentation, and I hope you will find it as interesting. So today I will be talking about how RRI, which is Responsible Research and Innovation, may be applied to support and guide research application of brain models by presenting the embrace view. So I'm going to be presenting a small story on embrace and basically what we did on that particular project. So just some background information on embrace. Embrace is actually the acronym for Embedding Responsible Research and Innovation in Future and Emerging Technologies. Embrace is actually a fact-finding exercise rather than a research project, and it was focused on research undertaken in the Horizon 2020 FET program. So that's research on future emerging technology, and which continued under the auspices of the European Innovation Council. The research under this umbrella program was characterized by radically novel ideas and technologies with the potential to change human lives and society as a whole. For example, in developing new therapies, new cures, as well as in developing new paradigms of social interaction. So these were the social benefits, but at the same time, these benefits raised some very concerning social and ethical issues linked to the purpose and outcome of that particular research, but also in terms of the exploitation of the data. If I go back to Embrace now, so it was not the case that the FET teams handed over their research to us at the end of their projects, and Embrace then took it onto the commercial or tried to launch a commercial product from that research. It was more a case about investing responsible research and RRI, or investing in responsible research and RRI with the FET teams. So this facilitated the teams to then go on into launching a commercial venture using the RRI. So Embrace is about integrating principles and practices of RRI to research translation and practices for commercialization. So in the context of applied brain models and modeling, the ethical issues typically occur at the intersection of neuroscience and ICT, which can raise many other issues and concerns, of which we are familiar with the traditional research ethics about protecting animals, about the use of human participants, obtaining consent, research integrity, with respect to conflicts of interest, publication, data governance, social issues, dual use, where the application of the technology might have both civil and military use. And so what is the response of the researchers in that case? How do they manage those issues? Also, there are philosophical questions or issues around the moral status, for example, among non-human primates used in research. So many of these issues, the ethical issues, are not clear-cut or settled. I mentioned the use of NHP models. Here I'm drawn to the article by Nijmegen, in which he argues that NHP models cannot be done ethically, or NHP modeling. A paper on ethical issues when modeling brain disorders in non-human primates is the reference. The other example has to do with functional MRI imaging, or I know it's also called psychophysiological interaction analysis. The the point with fMRI is that it is impossible to anonymize the data. So the brain imaging or the neuroimages include the identity of the patient or research participant, and it can be used to identify that individual. So it has implications for GDPR. There are techniques to overcome this, but it does not achieve it. Techniques such as pseudo-anonymization or the de-identification techniques, which essentially do not remove brain prints. So clearly, there is a need for the application of RRI in applied brain models. So this need for RRI is based on the benefits to be derived in its application in brain modeling. For example, in terms of justification of risk. Here we're talking about how experimentation exposes subjects to risk, and then that risk must be justified. I go back to the article by Niehaus, where she uses the lens of justice to argue that access to research is not just about protection from risk, but it's also a constitutive part of the ethical mandates governing clinical research. RRI also facilitates a license to operate. So this has to do with scientific validity, about the studies and how we adopt or how we define the process by which that study is conducted. So it's about conducting research on questions or asking questions that could be answered or that should be answered. The research methods are valid and feasible. You must have a clear scientific objective using the accepted principles of RRI. And of course, excellent science is always and must always be responsible science. Responsible science could have to do with the selection and recruitment of participants. And it's not just about healthcare, but it's about the justification of the benefits to society which outweigh the risks in the end. But this poses a moral question there. What approach will e-brains and other infrastructures in neuroscience take in the way it conducts its research? So, for example, how is the implementation of responsible practices to be executed in e-brains? So which RRI activities will be retained or which will not be retained? And then we're looking at the justification for this. What justifies that selection of RRI? Again, typically the answers to that question will revolve around the ethical mandates for clinical governance. It's about informed consent, respect for subjects, etc. So, what is RRI? According to the Rome Declaration, it is to align research and innovation to the values, needs, and expectations of society. It is basically a policy framework that seeks to, as I mentioned, align technological innovation with broader social values. And it offers support to researchers for decision-making concerning the goals and trajectories of research and innovation. This is particularly relevant when the conditions under which that research is executed are uncertain, ambiguous, or involve areas of ignorance. So the four main components of the RRI framework is about anticipating, reflecting, engaging, and acting. So the area framework as it is commonly known. So anticipation or anticipating the impact of research is not just about, or is not about prediction, but about exploration of the impacts of that research, for example, in terms of the social and economic impacts. Reflection is about deliberations on uncertainties, assumptions, and areas of ignorance, if I could put it that way. Engagement has to do with opening up those deliberations to dialogue in a way that is more inclusive and incorporates, a multidisciplinary perspective to the way that research is conducted. And acting, of course, is using the framework to influence the direction of that particular research. So RRI offers new ways of conceptualizing and of implementing reflection and discourse in research. Now, within that RRI framework sits the European Commission focus on what is called the constituent policy keys. It's also called the pillars. It's sometimes 5 pillars, but in this case, you will see there's 6 here. So action on these keys, the public engagement, gender equality, etc., is seen to be integral to an RRI approach, and the ability, and it facilitates the ability to respond to societal challenges. It's well and good understanding or knowing a little bit about the actual framework, but how do you go about using this particular framework? So if I could just run through the main concept of anticipate. So as I mentioned, it's not about prediction, but about exploration of the impacts of the particular research. And in terms of Orbit, which is a part of the Embrace program, we use the 4 Ps of process, product, purpose, and people within each of the main components. So process is about, for example, the research activities, including data collection, storage, methodology, the way we recruit research participants. Product is about the services and outcomes. Purpose is about why do we do the research, and people who are at the heart of that particular research project. So the operationalization of the framework is through answers to a set of scaffolding questions, basically, that facilitate a consideration of the range of ethical aspects. And this is to ensure societal acceptability and desirability of that particular research and innovation. Now, coming back to the Embrace program, this slide answers the question, how does Embrace support researchers in managing the social and ethical and regulatory issues related to applied brain modeling? So within this particular project, we interviewed 40 FET, that's Future Emerging Technology Launchpad coordinators under the Horizon 2020 program, on their knowledge of RRI and ethical issues. The Embrace project found that researcher skills and knowledge required to implement RRI were at best unevenly distributed, and on the worst scale, total ignorance of it. So Embrace collected responses such as, we just do the technology, or we do not work with live animals. We only work with human biological samples. Even then, being completely unaware of the ethical issues, for example, around anonymization or pseudo-anonymization. Other responses were, we are using a non-invasive procedure with no contact with the surgeon or robot. Others said, we use standard microelectric tools that are non-toxic, and this refers to the medical equipment. But the project did not progress to a commercial stage, so there was no need to incorporate RRI. So clearly, these identify a clear need for training in RRI. One particular response we got was that we do not deal with humans, but when we actually explored this particular project, we found that part of the work, or a large component of the work of this particular research program or team, included the recycling of waste electrical and electronic equipment, which under German law is governed by a regulatory issue. So the team, the FET team, was unaware of that. So it was, the conception there was that if it did not involve human participants, if we did not work with biospecimens, then we didn't need to have RRI. So, which is clearly identifies a gap that Embrace addressed as part of the HBP, which had been at the forefront of RRI integrated research and practice. So we in Embrace ran 3 focus groups with the Launchpad coordinators to refine the services that Embrace could develop. And we developed the 4 training courses that you will see here around data governance, stakeholder engagement, etc., to address this particular gap in research and knowledge. So when we look at the ethical and social issues in brain modeling, we look at how RRI training addresses these particular issues, and we look at how the content of that training addresses issues in terms of the ethical issues in terms of clinical diagnosis and neurobiotics or neurorobotics. So the application of RRI, for example, to clinical diagnosis, which is informed by brain modeling, for example. Here, the technology has helped humans to achieve a higher level of understanding of diseases and enables a better diagnosis. So the application of RRI is critical to the acceptance of the technology that facilitates the clinical diagnosis. And it is aligned with the expectations of society that technology-enhanced clinical diagnosis benefits humans. In the terms of neurorobotics, again, this is closely aligned with the FET projects that Embrace explored, because neurorobotics as well offers the potential for radical improvements in a range of disciplines, spanning neuroscience, robotics, neuromorphic computing, etc. So this ultimately may result in better treatment of brain-related diseases and in understanding our role as humans in the world. But at the same time, it raises concerns around ethical and social issues, such as obtaining consent, protection of animals, the moral status of NHPs, they're non-human primates, and all the way to, as you may recently recall, regarding the sentience of artificial agents and consequently the role of medical doctors in society. RRI allows us to address the conflicts of interest within the research and innovation as well. For example, in terms of globalization. So offshore sourcing and recruitment of research participants, particularly in low and middle income countries, typically in Global South, typically with little or no access to healthcare, they may be economically exploited to serve the interests of affluent persons elsewhere. But as I understand it, this is not typically an eBrains issue, because the data used for modeling is mainly or entirely Caucasian data. And this then introduces a level of bias. So the application of RRI necessitates transparency in that data set, as well as the principle of explicability that makes the extent of the applicability clear to an ethnic population who may want to use that data set. In terms of the second example around Chinese data, so we know that most of the research conducted in China, as well as Japan, include modeling on NHPs and transgenic experimentation. The application of RRI to brain modeling facilitates, as I mentioned previously, new ways of conceptualizing and implementing reflection and discourse in that particular research. And it is through the integration of RRI that we address the ethical concerns, for example, in terms of a data governance regime. So data governance here is responsible for, or is recognized as a core feature of eBrains, and it is a unique selling point of its services. So the application of RRI allows us or enables eBrains to become something of a world-leading infrastructure for responsible data governance for neuroscience. And it pushes the boundaries of theory and practice in data governance for large-scale neuroscience projects. The application of RRI in brain modeling also facilitates the option to take a leading role in the development of the EU health data space. So clearly an application in applied brain modeling. So what's the impact of this development of future emerging technology on society? So we look at, for example, what Embrace has taught us. There's a public perception risk. So this may actually, if it does not comply with the RRI alignment with the expectations of society, it may jeopardize the adoption of that technology. In particular, AI, or artificial intelligence, is seen as an enabler of solutions to grand society challenges, but equally it poses issues of trustworthiness and bias. So we need civil society involvement to reflect and engage in a way that is more inclusive of members of society. So in terms of brain modeling, the project runs a risk that that particular innovation may not be adopted by society. And some of the social and ethical concerns raised involve basically the alignment with RRI and the expectations of society. So data governance, again, here plays an important role in RRI in terms of its applicability to brain modeling. It emphasizes that research is not done simply because it can be done. For example, as Niehaus again puts it, researchers should not create macaques with social deficits or capuchin monkeys with memory deficits simply because they can. So it forces researchers to engage, to reflect, and to examine their own interpretations of RRI. Clearly, there's a need for researcher training in RRI. Okay, interdisciplinary collaboration is challenging. For example, a respondent on the Embrace research or project remarked that the use of, I think it was Tesla 7 MRI scanners had received FDA approval. So that project team was not at all interested in RRI, simply because it achieved FDA approval. So it follows that interpretations of RRI, if it is subject to debate, obviously then the implementation of RRI will equally have, be subject to that debate and incur problems for its implementation. It is very strange that the success of RRI implementation is very difficult to prove. But some insights that we gained from the Embrace project in terms of its application or the application of RRI to the applied brain models is that it is a contested concept, yes, but expectation management, therefore, is very important in how you implement it, for example, in the eBrains project. Uncertainty and conflict will remain, but it is important to remember that RRI does not offer a solution. It is a process, and it is a process that is operationalized by a specific framework incorporating key pillars and elements, or a scaffolding approach to which answers force the researcher to examine that particular research project in terms of its outcome and purpose. So in terms of applied brain modeling, RRI here offers the potential for intervening and interacting at a very policy level. Okay, I've included some of the references that inform my discussion here. The sites on the orbit, which is part of the Embrace project used in the exploitation of the commercial viability of research, is particularly focused on application of RRI. And the model that I just showed you about, the 4 components, the area framework, using the 4 Ps of process, product, purpose, and people, is is clearly marked in that particular website. Okay, thank you very much for listening.